Picture this. It's 2 a.m., you're at a friend's apartment, and you used a little cocaine maybe an hour ago. Nothing crazy, you've done it before. You're young, you're healthy, you hit the gym 3 times a week. And then your chest starts hurting. Not like scary chest pain, more like pressure, tightness. Maybe it's the bump you think. Maybe it's just anxiety. Maybe you had a little too much to drink. You tell yourself you'll lie down and wait it out. And here's the thing. A lot of people do exactly that. Some of them are fine. Some of them are dead by morning. Hi, I'm a board-certified emergency physician, and I see this exact situation in the ER more than you'd think. Today, we're going to talk about what cocaine actually does to your heart, why it can kill young, healthy people, and how to tell the difference between I should probably drink some water and someone needs to call 911 right now. No judgment, no lecture, just the information that might actually save your life. Real quick, this is educational content, not medical advice. If you or someone near you has chest pain, shortness of breath, sweating, fainting, or any scary symptoms after cocaine use right now, stop watching this video and call 911. Let me introduce you to someone I'll call Jake. Jake is 26. He wouldn't call himself a drug addict. He uses cocaine occasionally, a few times a year at parties. His doctor has no idea. His mom definitely has no idea. One Saturday night, Jake uses a small amount of cocaine at a friend's place. About 45 minutes later, he notices that his chest feels tight. His heart is pounding. He's sweaty. He's anxious. But cocaine can make you anxious, right? So he figures that's just what this is. His friends agree. You're just in your head, they say. Drink some water. Sit down. So Jake sits down. 2 hours later, Jake is in the emergency department. His troponin, that's a protein that your heart releases when it's damaged, is elevated. His EKG shows changes. Jake is 26 years old with no prior heart disease. Jake is having a heart attack. Jake is a composite of real patients, the kind of case emergency physicians across the country see regularly. And the tragedy isn't just what happened to Jake's heart. It's the 2 hours he sat down on that couch. Here's the version you'll actually remember. Cocaine tells your body it's being chased by a bear. Full panic mode. Heart rate surges, blood pressure spikes, your entire body and especially your heart is suddenly working at maximum capacity. Now imagine your heart is a car engine. Cocaine just floored the gas pedal and simultaneously tightened every fuel line in the vehicle. The engine is screaming for oxygen. The fuel lines are constricting. Something has to give. There are 3 main ways that cocaine can trigger a cardiac event. 1, the squeeze. Your coronary arteries, the blood vessels that feed your heart, can suddenly clamp down. Like someone squeezing a garden hose. Blood flow drops. If it drops enough for long enough, heart muscle starts to die. This can happen with no blockage, no prior damage. Just the artery squeezes and doesn't let go. 2, the clot. Cocaine makes your blood extra sticky. It can also rupture small plaques inside artery walls, even ones too small to cause any symptoms before. Rupture a plaque, the sticky blood rushes in, you get a clot, you get a blockage. Classic heart attack in a 26-year-old. 3, the electrical storm. Cocaine irritates the heart's electrical system. This can cause your heart to beat wildly out of rhythm, too fast, too erratically. Some of those rhythms are just uncomfortable. Some of them will drop you to the floor. And on top of all of this, cocaine can spike your blood pressure so severely that it can cause the aorta, the biggest artery in your body, to tear apart from the inside. Doctors call this an aortic dissection. Patients describe it as feeling like being stabbed in the back from the inside. It's one of the most immediately lethal things that can happen to a human being. Young people are not protected from any of this. The heart doesn't care how old you are. It cares about blood flow. Let's be real about something. The most dangerous moment in cocaine chest pain isn't the chest pain itself. It's the conversation that happens in the 30 minutes after. It sounds like this. You're fine. You're just anxious. You're going to be so embarrassed when this turns out to be nothing. If we call 911, you're going to get in trouble. Just breathe, drink some water, it'll pass. I've heard every version of this story in the emergency department. And sometimes the person on the couch heard all of those things before they finally came in, 3, 4, 5 hours after it started. Here's what I want you to know. If your instinct is that something is wrong, trust that instinct. The ED is never going to be annoyed that you came in. We are never going to say you wasted our time. The absolute worst case scenario if you came in and it turned out to be nothing is that you feel a little embarrassed for a few minutes. The worst case scenario if you don't come in is very different. After cocaine use, these are your call 911, do not debate this symptoms. Chest pain, tightness, or pressure, any kind. Shortness of breath. Sweating, nausea, or vomiting alongside chest pain symptoms. Feeling like your heart is racing or skipping beats. Dizziness or fainting. Sudden, severe back or chest pain, especially anything that feels like ripping or tearing. The worst headache of your life, especially if it's sudden onset. Weakness, numbness, or slurred speech. And finally, confusion or seizure. And the single most important thing you can do when you or someone else arrives in the ER is tell them about the cocaine. Tell them what, approximately how much, and when. This is not a legal confession. EMS and ED physicians are here to keep you alive, not to report you. Knowing cocaine was involved changes the treatment plan. In some cases, it changes which medications are safe to give you. Hiding it does not protect you. It just makes our job harder and puts you at risk. Here's what your ED visit looks like if you come in with cocaine-associated chest pain. You get on a monitor immediately. We check your heart rate, blood pressure, and oxygen level. We get an EKG. That is the 12 lead that takes a picture of your heart's electrical activity, usually within the first 10 minutes of you being there. We draw blood for a protein called troponin. If your heart muscle is being damaged, troponin leaks into your bloodstream. Here's the catch. It takes time to rise. So 1 normal troponin early on does not mean you're fine. That's why we repeat it. Usually at 3 hours, sometimes at 6. We're watching for a trend, not just a snapshot. While we wait for those results, we're treating what we can see. If your blood pressure is dangerously high, we address that. If your nervous system is in full fight or flight overdrive, we help calm that down. If your chest pain is ongoing, we have tools for that too. The observation period feels boring. It might feel unnecessary when you're starting to feel better. It is not unnecessary. It is the whole point. I want to leave you with one thing I hope you actually remember from this video. Young does not mean safe. Healthy does not mean immune. I've done it before and been fine is not a guarantee. Cocaine can trigger a heart attack in someone with a perfect heart, a clean bill of health, and no family history of heart disease, because it doesn't work by slowly damaging your arteries over time. It works by creating an acute crisis right now in whatever cardiovascular system you currently have. If something feels wrong, go in, be honest, and let the ED do its job. If this video helped you understand something you didn't know before, drop a comment below. I genuinely read them. And if you want more plain English emergency medicine content, subscribe. Stay curious, stay informed.